Meet Matt. When Matt was 28, he was diagnosed with schizophrenia. He was put on a few different medications, and after a while, things seemed to get a little easier. But Matt's noticed he's gaining a lot of weight. His doctor says it's a normal side effect of his medication and to start watching what he eats. But he feels hungry or tired all the time. He's lost all motivation and now feels really self-conscious about going out. Recently, Matt was invited in for a physical health check where he told his doctor how he's feeling. His GP explained that his blood pressure was too high and warned him this will increase his risk of having a heart attack or stroke. He prescribed him another medication to help reduce his blood pressure and told him that he needs to do more to exercise and improve his diet to get his weight down. Matt leaves the doctors feeling worse than ever. He knows there are things he could do to improve his health, but right now he feels powerless. It feels like everything is against him and that no one understands what he's going through. And Matt's not alone. People living with severe mental illness such as schizophrenia and bipolar disorder are more likely to live with cardiovascular risk factors like high blood pressure and diabetes, but less likely to receive the care they need for them. As a result, people living with severe mental illness die up to 20 years earlier than the general population, in large part from preventable conditions. So, in 2014, researchers at University College London began exploring how to best prevent heart attacks and strokes in people living with severe mental illness. With the help of patients, healthcare staff and behaviour change experts, they developed and tested a new intervention, Primrose. Primrose offers flexible, collaborative appointments that include behaviour change support with the aim of reducing cardiovascular risk in people living with severe mental illness. In a trial, patients who received Primrose were less likely to be admitted to hospital within 12 months, but there was no added benefit on their cholesterol levels. This could have been because during the trial, patients weren't always prescribed the most effective medications. To address this, Primrose was updated with an increased focus on medication as well as the addition of peer support workers, Primrose A. With the growing burden on primary care, there was a need to prioritise patients to ensure that those in most need would be seen first. So Primrose A was combined with UCL Partners' proactive care frameworks, which support prioritisation of patients according to clinical risk. The resulting intervention is called UCL Partners or UCLP Primrose, a programme that ensures people living with severe mental illness receive the right cardiovascular care and support from the right person at the right time. This is achieved through a pathway that integrates mental, physical, and social support, utilising the wider workforce to provide structured education and self-management of physical conditions in collaboration with patients and supportive others. For people like Matt, this means they are prioritised so that those with the greatest clinical risk are seen first. The first appointment, the health check, involves measuring things like weight, height and blood pressure, blood tests for diabetes and cholesterol checks, and advice about how to improve physical health. Some people won't respond to the health check invitation. Many times, these people will still be living with cardiovascular risk factors, so it's important to try to reach them. To do this, a mental health professional will perform a desktop review to assess their needs and support engagement through outreach or specialist support. Patients are also provided with clinical management of their risk factors, for example with medications to manage high blood pressure or high cholesterol. And, as well as lifestyle support throughout the pathway using brief interventions and signposting, when needed, patients also receive one-to-one intensive health support over a number of sessions to identify and work on a physical health goal together. with the use of wider social support maximised throughout the pathway. In this way, UCLP Primrose can transform cardiovascular care for people living with severe mental illness and help reduce the major health inequalities this population face.